Before we begin, I want to ask you a simple question. What if the shortness of breath you've been blaming on age isn't actually aging at all? What if the swelling around your ankles, the extra pounds you've gained recently, or the constant fatigue you've been feeling are not normal signs of getting older, but early warnings that your heart is struggling? Every year, millions of adults over the age of 50 develop heart failure, yet many never recognize the symptoms until the condition becomes serious enough to require hospitalization. As a physician who has spent years caring for older adults with heart disease, I can tell you that one of the biggest mistakes people make is assuming these warning signs are simply part of aging. In today's video, I'm going to share the 5 most common symptoms that often appear before a diagnosis of heart failure. One of them is so commonly overlooked that many patients live with it for months before realizing something is wrong. And the symptom that concerns me most isn't the one most people expect. So make sure you stay until the end because it could be the clue that helps protect your health or even the health of someone you love. But first, if you're over 50 and want trustworthy health information designed specifically for older adults, take a moment to subscribe to the channel and turn on notifications. Every week we share practical, evidence-based advice to help you stay active, independent, and healthy for years to come. Now let me tell you about a patient I'll never forget. A 68-year-old gentleman came into the clinic convinced that nothing serious was happening. He told me he was simply getting older. He noticed he was becoming short of breath when walking to the mailbox. He needed extra pillows to sleep comfortably at night. His shoes felt tighter than they used to. He was tired more often than normal. Yet he ignored these changes for nearly 6 months because he believed they were just part of aging. When we completed his evaluation, the diagnosis was heart failure. The good news is that it was caught before a major crisis occurred. The bad news is that many people are not as fortunate. That's why recognizing these symptoms early is so important. Let's start with the 5th warning sign because it's often the first symptom people notice and also the easiest one to dismiss. Persistent fatigue. Many patients don't tell their doctor they feel sick. Instead, they say something very different. They tell me, "Doctor, I just don't feel like myself anymore." Activities that once felt easy suddenly become exhausting. Gardening becomes harder. Walking around the neighborhood feels like a chore. Playing with grandchildren requires more effort. Little by little, life begins to shrink. What many people don't realize is that when the heart becomes weaker, it cannot deliver oxygen-rich blood as efficiently as the body needs. Muscles, organs, and tissues receive less oxygen, leaving you feeling tired and drained. The fatigue may be subtle at first, but over time it can affect every part of your daily life. And while fatigue alone doesn't always mean heart failure, when it appears alongside the other symptoms we're about to discuss, it becomes much more concerning. And speaking of concerning symptoms, the next warning sign is one that often sends people to the emergency room unexpectedly. The 4th warning sign is palpitations or a rapid heartbeat. Many people describe this sensation differently. Some say it feels like their heart is racing for no reason. Others describe fluttering in their chest. Some feel as though their heart is skipping beats or pounding harder than usual. While occasional palpitations can happen even in healthy individuals, persistent or frequent episodes should never be ignored. Think of your heart as the engine that powers your entire body. When that engine begins to weaken, it often tries to compensate by working harder and faster. In the early stages of heart failure, the heart may increase its rate in an attempt to deliver enough oxygen-rich blood to the body's organs and tissues. Unfortunately, this extra effort can create symptoms that patients notice as a racing or irregular heartbeat. In many cases, heart failure is also associated with abnormal heart rhythms, especially atrial fibrillation, commonly known as AFib. This condition becomes increasingly common as we age and can significantly affect the heart's ability to pump blood efficiently. Some people with AFib experience dizziness. Others notice worsening fatigue or shortness of breath. Some don't feel any symptoms at all until a serious complication develops. That's why this warning sign deserves attention. If you frequently notice a rapid heartbeat while resting, feel fluttering sensations in your chest, or experience episodes of dizziness alongside palpitations, it's important to discuss these symptoms with your healthcare provider. But while palpitations can certainly be alarming, The next symptom is often visible long before people realize their heart may be struggling. The third warning sign is swelling in the feet, ankles, and legs. Many patients first notice that their socks leave deep marks around their ankles. Others realize their shoes suddenly feel tighter even though they haven't gained much body fat. Some wake up feeling normal but notice significant swelling by the evening. This swelling, known medically as edema, occurs because a weakened heart cannot circulate blood as effectively as it should. As pressure builds inside the blood vessels, fluid begins to leak into surrounding tissues. Gravity then pulls that fluid downward, causing it to collect in the lower parts of the body. One of the clues doctors look for is whether the swelling becomes worse throughout the day. If your ankles appear relatively normal in the morning but become noticeably swollen by night, it may indicate fluid retention. In more advanced cases, fluid can accumulate in the abdomen, causing bloating and discomfort. Some people even notice rings becoming tighter on their fingers. The important thing to remember is that swelling is not always harmless. While there can be many causes, persistent swelling should never be dismissed as simply getting older. In fact, the next warning sign is closely connected to this buildup of fluid and often shows up before people realize what's happening. The second warning sign is unexpected weight gain. Most people assume weight gain comes from eating more calories than they burn. But heart failure tells a very different story. When fluid begins accumulating throughout the body, the number on the scale can rise surprisingly fast. Some patients gain several pounds in just a few days. That's why cardiologists often encourage patients at risk for heart failure to weigh themselves regularly. A sudden increase in weight can be one of the earliest clues that fluid retention is worsening. Imagine waking up one morning and noticing you've gained 3 pounds overnight despite eating normally. A few days later, the number continues to rise. At the same time, your ankles appear swollen and your energy level drops. This combination of symptoms may indicate that excess fluid is building up inside your body. Doctors often refer to a patient's dry weight, which is their normal weight when excess fluid is not present. Monitoring changes from that baseline helps identify potential problems before they become severe. Many people ignore rapid weight gain because it doesn't seem urgent. But when it happens quickly and without an obvious explanation, especially alongside swelling or breathlessness, it deserves medical attention. And now we've reached the symptom that cardiologists hear about more than any other. The warning sign that often appears first. The symptom that sends countless people to the doctor every year. The number one warning sign of heart failure is shortness of breath. If there is one symptom I want you to remember from today's video, it's this one. Many patients tell me that their first clue something was wrong came when ordinary activities suddenly became difficult. Walking across a parking lot felt harder. Climbing a flight of stairs left them winded. Carrying groceries became exhausting. At first, they blamed aging. Then they blamed being out of shape. Eventually, the symptom became impossible to ignore. Here's why it happens. A healthy heart pumps oxygen-rich blood efficiently throughout the body. When the heart weakens, it struggles to keep up with demand. As a result, less oxygen reaches the muscles during activity, making even simple tasks feel exhausting. But there's another reason breathlessness develops. Heart failure can cause fluid to accumulate in the lungs. When this happens, breathing becomes more difficult, especially when lying flat. Many patients tell me they started sleeping with extra pillows because they felt uncomfortable when lying down. Some wake up suddenly during the night gasping for air and needing to sit upright before they can breathe comfortably again. These are classic warning signs that should never be ignored. What makes shortness of breath particularly dangerous is how gradually it can develop. Many people adjust their lives without realizing it. They stop taking walks. They avoid stairs. They become less active. They unconsciously change their routines to avoid triggering symptoms. Over time, what seemed like a small inconvenience becomes a major limitation. That's why recognizing this symptom early can make such a difference. Now let's quickly review the 5 warning signs we've discussed today. Number 5, persistent fatigue and low energy. Number 4, palpitations or a rapid heartbeat. Number 3, swelling in the feet, ankles, or legs. Number 2, unexpected weight gain caused by fluid retention. And number 1, shortness of breath, especially during activity or while lying flat. Remember, experiencing one of these symptoms doesn't automatically mean you have heart failure. However, if several of these warning signs are occurring together or becoming worse over time, it's important to seek medical evaluation. Early detection can lead to earlier treatment, better outcomes, and a higher quality of life. Before you leave, I want to hear from you. Which of these 5 symptoms have you noticed recently? Type the number in the comments below, 1, 2, 3, 4, or 5. I read every comment, and your experience may help someone else recognize a potentially serious problem before it's too late. If you found this video helpful, please subscribe to the channel, give this video a thumbs up, and share it with a friend or family member over the age of 50. Thank you for watching, stay healthy, stay informed, and I'll see you in the next video.